Excellent. Excellent. I have the honor and the privilege of hosting my brother on my podcast. I think this is for the second time. We're on episode 16 now. I can't believe it's gone that fast. And thank you very much, listeners and viewers. You guys have been great. I think I said this earlier this week on my podcast. I've had over 60,000 views on social media in the last couple of months through all my social platforms. So follow me on LinkedIn, follow me on Facebook, follow me on Instagram. You can also see all my pre-recorded and previously recorded podcasts where we talk about science, where we talk about hard work, where we talk about quarantines, where we talk about business. We talk about all those things. You can find those on YouTube, on iTunes, on Spotify, and on SoundCloud. Go to my website, drsneedham.com, to visit all that, and you can find all that information and more. And so it is an honor and a pleasure to host my brother today. We are taking callers today, if anybody wants to call in, because I think it's a topic that's actually very important to all of us. And so our number is 877-995-2111, and we call in and you can talk to us. We have what we're going to be talking about today with my brother. Obviously, he's my twin brother. You can probably tell that.
Oh, by the way, just to let you know, I wanted to show you I wasn't lying about the shirt. See?
Oh, yeah. Well, I wore that one on Monday on my podcast, and now you've got that one. I say you take one button down, by the way.
Oh, okay. So, and by the way, just to let the viewers and listeners know, we don't shop together. This just happens quite frequently. I swear.
It does. It
absolutely.
Yeah, it absolutely happens all the time that we just sometimes show up and we're wearing the same clothes and we don't shop together. It used to happen when we were younger, but
Since kindergarten.
Same house. Yeah, but it happens a lot now too. So anyway, so pleasure to have my brother on the show. And today what we're going to be talking about are healthcare costs, and something very near and dear to all of our hearts, something that we've all think about. And my brother has an awesome story, like we all do. All of us have stories. Please call in 877-995-2111. Call in, because you know why? Especially you people that work in healthcare, you know the system is scamming people. You know, these are hard conversations. If you're a nurse, if you're a doctor, I'm not saying that you're necessarily the problem. The system is the problem. We'll talk about that. I want to hear from you. I want to hear, for example, why you charge $19 for an acetaminophen, why you charge $19 for an ibuprofen. These are things that are crazy to talk about, and it is absolutely scamming the patient, who is the customer, kind of, but that's the problem. And we'll start talking about that. Okay, so Shawn has a story where Shawn, why don't you first introduce yourself?
Well, my name is Shawn Needham. I'm a pharmacist. My wife and I have owned a pharmacy for almost 22 years now. My wife's a pharmacist also.
Congratulations. You guys are a great team, by the way.
Thank you. Yes, I don't know what I would do without her. And she's just a wonderful patient advocate. And, at our pharmacy, we're kind of different. We're a compounding pharmacy. We specialize in health and wellness. We realized many, many years ago that the regular healthcare system, traditional healthcare system, was not helping people, but sometimes enabling them to make bad lifestyle choices. So we changed that a few years ago, and we focus on health and wellness with patients. And one of the things that really, really sets us apart is we have been a non-insurance billing pharmacy since 2002. So for 18 years, we have not been in the racket of billing insurance. Why is that? Because we believe, and this is what we tell all of our patients and our clients, we do not bill insurance in order to offer the best possible price and the best possible service to the patient, period. When insurance gets in between a patient and a healthcare provider, things get more expensive and the service goes down, period. And if anybody wants to call and debate me on that, I would love to take the call. I've been debating this for 20 years now. And I totally believe, I think health insurance is a complete scam. It's a complete ripoff. My wife and I don't have traditional health insurance. We have a health sharing ministry. There are health sharing programs out there that are non-faith based. So, there are many, many options. Health insurance is a complete ripoff, and it is what's causing healthcare to be expensive.
Yeah,
okay,
I know there's
an introduction to me. Go ahead.
there must be lots of people in the audience shaking their heads. And so I know I can think of some right now. And so Shawn, tell us a little bit about your podcast that you actually have started and you've had going for over a year now. What is it called? I think we can see the banner in the background, Health Solutions.
Yeah. Health Solutions with Shawn and Janet Needham.
Yeah, it's awesome. Tell us a little bit about that. And
we started actually October of last year, and we started it to educate and empower patients and individuals about their healthcare, and that they should be in charge of their own healthcare, including their own healthcare costs. And people don't realize that a lot of times. Jan and I have been dealing with this for many, many years, and we take some things for granted because we just know the system. I've worked in a hospital. I've been a hospital commissioner, a publicly elected position for our local community hospital. I know how the system works inside and out when it comes to employee benefits, when it comes to how those things are paid, when it comes to how the hospital bills and writes stuff off. I know the whole system. You can't pull the wool over my eyes, okay? And because I've been in the system and I have had a pharmacy where we build those insurance companies, we know what a racket it is. We know what a ripoff it is. We felt like we had to have integrity. That's why we stopped doing it. I do believe this is nothing personal to healthcare providers. I am quoting Dr. Keith Smith, the owner of the Surgery Center of Oklahoma. I used to defend my colleagues that were in the system, billing insurance in the entire system. I don't anymore. Essentially, if you are in that system, this is nothing personal, but you are an accessory to the crime. And that's what Janet and I felt like. We no longer wanted to be accessories to the crime. We stopped billing insurance.
That must be so liberty-loving and just freeing to think that you're not emboldened to have to stay on the phone for hours to try to get insurance to reimburse a patient or it's what somebody described it to me is it's like gangster tactics.
Oh, totally. Oh, it would be illegal if Congress didn't make it legal. It would be illegal.
Right. Yeah. Well, we'll get
healthcare providers. They extort healthcare providers. But yet I don't feel sorry for the healthcare providers because here's the answer. Stop taking it.
They allow it.
If you don't like it, if you don't like Medicare reimbursement, you don't like how they have gangster tactics and they take money back from you, then don't take it.
Yeah.
Period.
Yeah.
And don't tell me you got to take it to stay in business. I know we're financially viable without it. I know many healthcare providers, doctors, ARMPs, clinics that are thriving. In fact, watch an episode from Michelle Murphy, P3 for life, peak performance and prevention. She says that she wished she would have done it earlier because she's actually doing better than she was when she was taking insurance financially. And not just that, but when I spoke at the Free Market Medical Association, they asked me, they said, not only are you surviving, you're thriving. Let me tell you this, it's not just about finances. To me, it's liberating. I no longer answer to an insurance company. I answer to patients. Those are my customers. I love it. And I will do everything I can for them.
I think that's awesome. I think it's awesome. And so that's great that your story is, and congratulations to you. And I have similar stories. I also am I'm self-insured, so to speak, which I think, people say, oh, that's not possible for everybody. Well, all I know is I save lots of money by going through a Christian healthcare sharing ministries. And I'm going to try to have somebody on to talk about that in the next couple of podcasts as well, because it is possible. Many, many people do it. And I save thousands of dollars on it. But you know what? It puts me in charge of my own healthcare. So especially on my podcast here, Secrets of Success, with the theme Never Be Outworked, Shawn, you and Janet have just absolutely been great examples of that, of very successful people, of obviously, I mean, you guys wouldn't believe their stories, you viewers, and well, anybody who's an entrepreneur would. But the trials and tribulations that they have gone through to get to where they're at, especially when they were starting, were absolutely incredible. And the cool part about it is to watch them as a team. And Janet has always been highly involved in the pharmacy. She's a pharmacist herself. She's just been great. She would actually take the kids to the pharmacy when they were really, really young, and they'd have a crib there. I remember seeing that. So hard worker to both of you. Great job, you guys, and really, really, really good job. So let's get into about your son. This is why you're on the show. I'm excited about this because it tells a story. People have seen that I've been advertising this for a couple of days. So my nephew, Jordan, I'll give you the story. My nephew, Jordan, Shawn might have even been with me. We might have been together. We were talking, I think, something like that.
We were talking when it happened, yeah.
We were talking when it happened. My nephew, Jordan, a month ago or so, maybe it's been 2 months now. I don't know.
6 weeks. 5 weeks, 6 weeks.
Okay, 5 or 6 weeks. He actually broke his leg, and it was a compound fracture. Okay, obviously serious. Deadly? No. We tend to make things bigger than they are in healthcare. No, these things, compound fractures have been set for years. It used to be your local doctor, your local general practitioner. He'd set the thing and put it back together, and you'd be fine. So don't make these things a bigger deal than they are. Okay, I'm not saying that is not a critical thing to get fixed. I'm not saying you shouldn't get it fixed. Okay, and this is what I tell my kids: broken bones and bloody things have to get fixed. Other things, you probably don't need to. You can take care of yourself. Chronic disease, you can fix yourself, for example.
Mostly, yeah, for sure.
Yeah. So point of it is, he went to the hospital, and anybody who's ever paid for their own hospital bill, which the minority of people don't. So right when I go to the hospital, if it's my child that had croup or something like that, the first thing I do is I get my child stable. I make sure they're okay. And then I go talk to the billing people and say, hey, if I pay cash before I leave here, can I get a discount? You know, the first thing they say is, we don't know how much it will cost. And I'm just flabbergasted every time. Right. Or I'll say, can I pay now? I'll even sometimes try to give them cash. We can't take cash. What?
It's crazy. It's ludicrous. It's ludicrous. It's insanity. I mean, imagine checking into a hotel. Well, how much is this hotel going to cost tonight? Oh, we don't know. It's a bill in 6 months.
It depends on how we code it when you leave.
Right. Oh. Well, and then of course, the healthcare entities always say, well, it's really complicated. Wait.
Because you make it complicated.
Right. Now, a new car is pretty complicated. Do you agree?
Yeah.
There's lots of moving parts. There's lots of electronics. It goes way over my head. Ask them.
The business I own is actually very complicated. We do pharmaceutical testing. Okay, it's very complicated. Yet we know how to price for it. And
right. And when the customer calls up, you know exactly what the price is. Right?
Yeah.
And that's the same with us too. Now,
could you imagine if you told them, I'm going to send you a bill afterwards, but I'm not really sure what it's going to be?
Right.
They wouldn't use you.
Right. Here's a scam. Right. Like James Dunovat he made a great example about complicated healthcare pricing on a podcast I had him on a few weeks ago. And it's just a great example of, I just love it. He said, well, of course it's complicated because they make it complicated. Imagine if you went to a grocery store and you went to the you were buying a gallon of milk and you went to the cashier and she had no idea what to charge you because she doesn't know what program you're on. So what do I charge this person? How much do I charge them? Because I don't know what program they're under. Yet if you charge the same amount to everybody, it's pretty easy. At our pharmacy, it's really easy. Somebody calls up, they want a price. It's that easy. I challenge anybody. If there's any pharmacist or anybody in the pharmacy industry watching right now, I challenge, or anybody that wants to verify this, call a Walgreens pharmacy, call a Rite Aid pharmacy and ask them a cash price of a medication. If you could see their eyes, they would roll in their head. And they're like, I have no idea. The first thing they're going to say is, what insurance do you have? Oh, I don't have insurance. I'm going to be paying cash. Well, we don't know. I mean, usually we bill your insurance. They tell us what to charge. Ludicrous. Now, 26 years ago now, when I got out of pharmacy school, there was a lot of cash patients because Medicare did not pay for medications yet. So we had to be very price competitive. And when Medicare Part D came in the 2000s, all of a sudden,
wasn't that the donut hole rule or something like that?
Oh, there's rules like that. I don't know anymore. I don't deal with it, and I don't feel sorry for pharmacists to complain about it.
Right.
Just don't deal with it. So, Medicare started paying for medications, and immediately, basically, all cash patients went away. Not all, but most. So pharmacists have to be competitive.
Stop that a minute. What happened to prices when Medicare started paying for medications?
I'm glad you asked, Shane. The next year, the price increased 19% of prescription drugs.
Unbelievable.
It's not unbelievable. It's totally. Read my book. This is all in my book, Sickened, How the Government Ruined Healthcare and How to Fix It. It's on Amazon Kindle version. I'm working on an audio version now and hopefully have a paperback and audio version out by the end of the year.
Congratulations to that book. By the way, I'm very proud of my brother for writing that book. That book was #1 in its categories when it was released on several types of categories that they categorized it on in Amazon. So congratulations.
It was super cool.
Yeah, that is awesome. Congratulations.
Thank you. The Saturday after we released it, we sold 1,478 copies on that Saturday. So I was.
Tell us about that book again and where you can find it.
Amazon Kindle version. So Amazon, it's $2.99 unless you have Amazon Prime. It's free, and it's 114-ish pages. You can read it in a couple hours. It's called Sickened: How the Government Ruined Healthcare and How to Fix It.
Because I want to get to this before we get back to Shawn's story and my nephew's story, which is just incredible. And I'm glad he's okay. And by the way, he had a compound fracture and they fixed it, so to speak. Shawn, was he working out on the bench press in about 3 days?
Bench press, no. He was using dumbbells. In 2 days.
He was
and by the way, he was in the gym today doing full body workouts.
Incredible. That's awesome. He's not going to let it.
Not really.
You know what? I would tell you this only as being a coach, being around a lot of kids, that work ethic does not come from him alone. He learns that from his mom and his dad. He sees you guys go to work every day, sees you guys get up early, sees you guys, have to struggle. So kudos to you guys as parents. Congratulations to both
right.
you.
He sees us eat well. He sees us exercise.
Right. So let's get back to
the healthcare provider. When he was admitted to the hospital, the nurses and healthcare providers couldn't believe how healthy he was.
Yeah.
And he's 17 years old. Well, he was 18 at the time. An 18-year-old should be healthy.
I know.
A 50-year-old should be healthy.
Shawn,
but that's not the norm in America anymore.
No, and we've had this on a previous podcast. I don't remember which number it was, but we've talked about the obesity pandemic, even in school children. I mean,
it's right. It's sad.
It's really sad. Yeah, I have a great story.
That's my book, Sickened. That's kind of just a catchy title, and how the government ruined healthcare. And the reason I say that is because there's so many things, Medicare for all, and how's the government going to fix the healthcare mess? The government screwed it up. And you'll find out in my book, when I started writing the book, I could go back to 1865 when the USDA was one of the first government programs that then later became a big central program that kind of screwed up healthcare. But I decided to limit that. And I started with Social Security Act back in the 1930s, where the government really started being a nanny state with Social Security. And then later on in the 60s is when Medicare came in under the Social Security Act. And I mean, prices and utilization just skyrocketed. And so the government's not going to fix it. The way the government will fix it is to get out. The free market is going to fix it. And the free market is working now. It's better than ever. After Obamacare passed in 2010, there's been many, many people that have lost their insurance, me being included. We decided to do something different. And the free market, we shop for pricing. We shop for all of our healthcare, and it's amazing. So yeah, check it out.
So caller, if you're on the line, stay on hold, and I'll get to you in a minute. So stay on hold. We have a caller, Shawn, possibly looks like on the line. I'll screen them and then we'll get to it. So let's get back to George, because people talk about insurance is the problem. So the government actually is onto this. The government creates what we call a victim triangle. They create a victim, that's the consumer, which is not the patient, but they're not the payer. But anyway, and they create an enemy, and the enemy is insurance companies. And then the savior is the government. No, that is wrong. Because you know who controls the insurance companies? The government. I mean, the government is the enemy. Do not say it's the insurance company that's actually spamming you guys, because the government is the one basically that allows them to set prices. Did you know? I'm just going to Shawn and I are going to go way off this topic today, and we're going to be all
no, really, it's all on topic.
It is all on topic. Did you know that a local doctor that starts their own practice cannot go buy an x-ray machine and use it, even if he can provide it cheaper to somebody else and provide x-rays? Did you know that? Shawn, talk about that.
Well, okay, so x-ray machine, not so sure there. But an MRI?
The answer is yes.
Maybe. I don't know that one.
Okay.
But there's what's called certificate of need laws. And every state's a little bit different. And I don't even know Washington State. But I know there's a big case in North Carolina where a radiologist wanted to open up his own cash-type practice and offer patients inexpensive imaging, CT scans, MRIs. And the state told him there wasn't a medical necessity. He needed a certificate of need, and he didn't meet that because the local hospital already had one.
And they charged 10 times as much.
Oh yeah. So local hospital essentially has a monopoly because of these certificate of needs. So, in a free market, that's just not right. I mean, that's how these hospitals and these healthcare providers that are bad, that's how they're able to stay in business, is with these bad government regulations. In a free market, they'd go to business.
So like we even locally here in Moscow, Idaho, we have places where you can go to a surgery center, or in the Palouse anyway, surgery center, or you can go to the hospital, and it's half or sometimes less than the cost from a hospital, but they know they can get the price, so they're going to go to the hospital because somebody else is paying the bill. It is a absolute phenomenal racket, but the hospital will never tell you that. The hospital would never say, well, you can get a better price over here. They would.
Here's the reality, and people are catching on to this, is that you can still go to that local hospital, but many times you will end up paying more out of your pocket, even after insurance, because insurance is a ripoff than you would if you would have just paid cash in the first place at a surgery center. Good example, Surgery Center of Oklahoma. So we'll get back to my son's story a little bit, and then I'll go into the details of it. $46,000 at our local hospital
for a broken leg.
For a broken leg.
Now listen to this. Somebody posted this on Instagram or Facebook a couple of weeks ago. This is a gentleman about my age. So this probably would have been in the mid 1970s or maybe a little bit later. He showed his parents' doctor bill from him breaking his leg in the 70s.
$500?
$365.
Right.
And same type of injury now, Shawn, 40 years later, and it's 40,000.
Don't give me the inflation thing. That is not inflation.
That is not.
But listen to this. So,
and it has nothing to do. Here's what we're trying to do, and the government is trying to do it, whether it be Obamacare or single payer systems. If you think that's the answer, that's great, but it's not. None of this is sustainable. And if you look at the actual data, prices have skyrocketed the more government gets into control. Airlines used to be controlled by the governments, and only wealthy people could fly. And they tried to keep people like Southwest out of it. Luckily, Southwest survived, but they were not. Believe me, go look it up.
Pan America was a monopoly.
Monopoly. The government
when it got deregulated, they went out of business.
Absolutely. So it's no different in any industry when the government gets involved in it. Price will skyrocket, and quality is going to go down. Period.
Yeah. A good example is another good example is tuition at colleges.
Oh,
because the government pays so much of it, prices have skyrocketed, and services went down.
It's also not just the government there, but we think about always the consumer should be the user of the goods, and who also pays the bill. Well, that's not happening as much anymore. The government either pays it for kids or their parents pay it. And so they don't even know the actual cost.
Right.
And so somebody else is paying it. So the cost goes up because the parents are like, oh, I got other fish to fry. I'm just going to pay it. So anytime there's a third payer involved, and it's not, or a second payer, and it's not the consumer and the patient paying the bill, price is going to go up. Absolutely. And so I would be glad to openly debate. Anybody on my show, you're welcome to come on my show. I'm sure you're welcome to come on Shawn's and talk about single payer systems and talk about what the actual solution is. Here's what I know. The solution is no matter what you think the solution is, on if it's single payer or cheaper health insurance or more regulations or less regulations, it doesn't matter. Our current system is not sustainable. No. It is not sustainable. So that's a whole different topic. So we get this $40,000 bill for a broken leg.
Well, let's talk about the situation first.
Yeah, I want to hear about it because Shawn, you probably didn't get that bill right away.
No, I was surprised how fast I got it, and kudos to them.
Okay, good for them. Okay,
and first of all, here's what I want to say. He got great care from the time the ambulance picked him up to the time he was discharged from the hospital, and even the follow-up visits. He got great care. So I've got no complaints there. So, he was trying to jump a canal, and he came up a little bit short, and he hit his upper tibia, left tibia, and compound fracture. My other son, Shawn Michael, was with him, and another friend, and they called the ambulance, and ambulance picked him up. It did a great job.
By the way, he did make the jump, actually, right?
Oh, he did. Oh, yeah, absolutely, of course. And I'm making sure when he was in the hospital, he knew he made it. So And I told him what he needs to do when he heals is he needs to go back there and he needs to do it again.
He probably will.
I hope so. But his mom is not too happy about that. But that's why kids have moms and dads.
That's right.
So so he goes to the hospital. He gets there. I'm kind of guessing a little bit, 6 or 7 o'clock at night, and Janet is on the phone with me. We're trying to decide options. We knew my older son had a orthopedic surgery down in Tri-Cities a few years earlier and had great service at 1/5 the price because they gave cash discounts. It was late at night. He was in the ER. We didn't have a lot of options. And hospitals take advantage of that.
They do. They
absolutely totally take advantage of that. Now, let's just talk about that though. Most things are not an emergency. And let's talk about this. Remember, during this COVID lockdown and stuff, hospitals can only do essential services. Most hospitals were ghost towns. That right there should tell every consumer of healthcare that most hospital services, you can price shop them. If they're not essential,
because they're not an emergency, you don't really need them.
Exactly. So make sure you price shop them. If you have any questions, I can get you prices on.
There's a website. I've used it before myself for lab tests and stuff. There's a website online like freemarkethealthcarepricing.com or something.
Go to the Free Market Medical Association website, and they have a shoppable healthcare pricing. So so he got great care, got surgery, had to have a plate put in, and he was discharged the next day about 9 o'clock. So got a bill about a week later. And here's what I want to tell everybody that's listening about hospital bills. Remember, so I have Christian healthcare ministries I pay the bill and they will send, and then people share my costs and they will send the bills back. They will send me money to pay my bill.
It works great, by the way.
It works awesome. It's amazing. If you don't believe it, go to their website. Unbelievable.
Out there. It's
people get cancer, people have heart attacks. It's covered. It's not insurance. It's better than insurance. I will never go back as long as the government doesn't make it illegal. And if the government makes it illegal, I will find some way to do something different than traditional healthcare insurance because it is a rip.
The government can't stop the free market. We've seen that.
They tried for years. It doesn't work with cocaine. So
exactly.
I know that sounds like an asinine analogy, but it's true. I mean, you can't stop the free market.
You can't stop demand.
No. Yeah. So I get the bill about a week later. And here's what I'm going to tell you guys. There is no fire. No fire, okay? The average insurance company doesn't pay these hospitals for 3 to 4 months. So, which is ridiculous. It's a bad business model, but that's what the hospitals decide to get into. In my opinion, if they just charged what was reasonable to begin with, we wouldn't have to go through this process. It would be a done deal.
When you pick up your car from the mechanic with an oil change, you pay them 3 months later, don't you?
Right.
Right. They would never let you come back.
No. And then he sends me a surprise bill later on saying, "Oh, we forgot to bill you for this." No, that's not how it works.
But Shawn, you can't compare healthcare to cars.
They're commodities. Like anything, they're shoppable.
Remember that.
It's like our food.
Healthcare, actually, everything in the free market is a commodity. Everything. No matter how, I don't care if it's Amazon or selling rocket fuel to NASA. That's a different story because there's probably some government contracts involved, but right? Where it's a monopoly, and there's greasy palms involved, but everything is a commodity. I don't care what kind of a tech business you have, there will be somebody that can compete with you. And that is the beauty of free market capital.
I love it. I've got it in my business and I love it. And I tell my clients that the free market keeps me on my toes. I love it.
Complacency will kill any business.
For sure. And the only true monopolies are when the government creates them, like hospitals.
A hospital is a monopoly.
Yes.
Period.
Yeah. In general,
you and I can't go start a hospital.
We need a certificate of need.
Right, exactly.
Right. And by the way, this is nothing personal, you guys. This is nothing personal. This is just about education.
Yes. Yeah.
So we got the bill about a week later, and here's the thing. I had no idea what to expect. I was expecting anywhere between $10,000 and $40,000. It was
Which is ridiculous.
14,000.
Which is ridiculous that that's a range.
Right? I mean, if I went to buy a new car, I would know pretty much how much I'm going to spend.
Right. Absolutely. Yeah.
But so it's ridiculous. So I get the bill, and here's some education pieces that I want you guys to understand. So first of all, don't pay the bill right away. Call their financial office, get a discount. There is all kinds of discounts. Now, here's the thing. Jordan was 18. They thought he might qualify for some other discounts.
But still living with you. You were still providing for children in high school, basically, you know.
Yeah. And probably, could he sign up for state Medicaid and get this entire thing covered? Absolutely. He probably could. I'm sure he could. First of all, I have integrity. I want to pay for my son's bills. I'm responsible for it. The state is not. The hospital loves to sign people up for those programs. And they've done it to one of my sons already. And it is a racket. And I warn you guys, do not let it happen.
Well, here's what I can tell you.
How they continue to overbill is they sign people up for these insurance programs, you know, whether it be state funded or whatever, because they think they can qualify. No, that's not how it's going to work. I'm going to pay this bill. I'm going to be fiduciarily responsible. I'm going to pay my bill, but I'm going to pay it appropriately at an appropriate price.
Call it what it is. It's not an insurance program. It's welfare.
It is. And it costs the taxpayers. And
it costs the taxpayers, and it is an absolute racket. Now, here's the thing.
It allows the hospital to continue to bill for services overpriced.
Patronizing to me and offensive.
It is.
When I go into a hospital and I say to them, if my son was there, my daughter, whatever it was, or myself, and I say, hey, can I get a discount before I leave and get a discount because I'm cash pay? You know, the first thing they say is, oh, I'm sorry. Would you like to sign up for a government program? No, don't be sorry for me. I have the resources. It's my responsibility. I'm not going to suck off the government.
And here's your answer. Oh, no, I've got something better. I'm going to pay you today. You're going to give me a discount. You're not going to dot all your I's, cross all your T's. I'm not going to take the money back 6 months from now.
Right.
You're going to give me a good price.
Yeah. And I usually do negotiate and say, hey,
if they don't, and you call them ahead of time, then walk out. If they can't give you a cash discount, then don't go there.
Yeah.
And if their cash discount in a hospital is off a $40,000 bill, is the first discount they offer is 20%. If you pay right now, no, that's not going to happen. Because by the way, I price shopped, and it's the Surgery Center of Oklahoma. Dr. Keith Smith, I respect him so much. A cash-only surgery center will never, ever build a government program. The same surgery, $6,300.
Whoa, wait a minute, Shawn.
I'm not kidding.
You're telling me they billed you $40,000.
46 with the
40,
46 including the physician fees, because there's all these other fees in there.
Oh, did you get billed by the anesthesiologist yet?
No, that was actually in there. But I got billed by radiology. I got billed by the doctor. Yeah.
Okay. So you're saying, what is that? 8 times. You could have saved 8. Now here's what some people are going to say. Oh, but Shawn, it was an emergency. Does Keith Smith at his Free Market Healthcare Association in Oklahoma, does he have an emergency room?
Oh, yeah. You know why?
Awesome.
Because the free market works. So there's an emergency room that opened right across the street from him. They just happen to work really closely together.
And so that total bill would have been $6,000.
I will say this. After I talked to Dr. Smith, there would have been some hardware charges on there. It would have been well under 10. It would have been probably about $8,000.
So you're talking at least 4 or 5 times less. At least
Correct.
4 or 5 times.
Usually he has many stories where it's 10 to 1. And in my experience, working with cash providers versus hospital providers, it's about 10 to 1.
And when we say cash providers, we don't mean just cash providers, but we mean surgery centers. We mean not hospitals. If you can go to a surgery center who specializes in these things, go there. Don't necessarily go to your.
Not only will you get a less expensive price, you'll better service. Absolutely. I can attest to that with my wife and some of her procedures. When we were going to the local hospital, they would put us off. It was a 12-hour procedure. We drove out of town, got it for 1/5 the price, and it was a 30-minute procedure instead of 12 hours.
Yeah, and because they know your pain. So when the consumer is actually the payer, they treat you well.
Yeah.
Whereas
Realize this, listeners and viewers. When you have an insurance, no matter what it is, you're not the customer. The insurance company is, and that's why they don't treat you the best.
Right.
I'll tell you what. You know what? All of a sudden makes that hospital start treating you better or treating somebody else better. When the insurance company threatens to take money back, all of a sudden their buddies they're putting out fires to make sure they don't. Yeah. But they don't do that for the patient. It's amazing. Right. That's why it's a racket. So the first thing is don't pay the bill right away. The second thing is ask for an itemized bill. And you posted my itemized bill. There's some things in there that are just ridiculous. I'm going to go through the entire bill. I'll give you an example.
Yeah, talk about it a little bit because
I'll give you an example.
First of all, it's so hocus pocus and robbing from Peter to pay Paul. It's an absolute joke. It is an absolute joke. It's a scam. It is when you read these itemized bills, they're almost unreadable. And somebody says, well, it's a different code. What the heck is that? That means nothing to me. You're going to code it differently because of how I looked or how I acted or how long it took. That's not my problem. It's like when I set a price on a product of my business, sometimes I make money, sometimes I lose money. My problem. Now I've got to choose what I'm going to do at that price. But I don't get to, if it costs more, I don't get to charge them more.
Now, speaking of that, here's one thing the hospitals argue. And if you look at my Facebook post on my Sickened website or my Sickened Facebook post for my book, there are people posting on there when I posted the price. It's like, well, hospitals lose a lot of money on Medicare and Medicaid, so they've got to make it up somewhere else. Hey, wait a minute. That is not fair. That is not fair at all. That's called cost shifting. And that's why I stopped doing it in my pharmacy, because you lose integrity. It is not fair. If you're losing money on that government program, don't take that government program.
Does that seem fair, viewers? Does that seem fair, listeners, that because they lose money on Medicare or Medicaid, which I don't believe, by the way, I don't believe it, get more efficient. Okay, period. Provide a better product more efficiently, period. Bottom line. Okay. Right. Businesses don't stay in business if they're losing money.
Unless they're a hospital and they're monopoly.
Exactly. Right. And if you lose money, you get more money from the government in the end of the year.
Correct.
Right. Which is just, yes, viewers, yes, listeners, this happens. When your local hospital, I don't care if it's a for-profit or a nonprofit, loses money, they get more money from the government at the end of the year. Especially
Why do you think most hospitals are not in too much of a fire to open back up after COVID? They know the more money they'll lose, they'll get bailed out.
Absolutely. There will be another big stimulus check coming for healthcare providers and hospitals, especially because of COVID-19 by the end of the year. I can almost guarantee it. And remember that money, it's printed, but who's it's printed on? It's printed on the backs of all of us taxpayers who work hard. And you know what? Our children. That is debt for our children to inherit for the rest of their lives. And it's not fair. And so does it seem fair that somebody on Medicare or Medicaid is going to get charged less because they have to make money off the person that doesn't choose to be on Medicare, Medicaid, or insurance program? That is crazy. That only can happen in government situations. They have created this problem. Yes, the government has created it. I'm not saying, viewers, that this is an easy solution. We all know there's a problem. Now, what is the solution? I have my ideas. That's a whole nother topic. The free market could take care of this. But
on a hospital bill solution, here's one of the solutions. So first of all, ask for a detailed bill. Okay, don't pay anything right away. Yeah. Get a hold of somebody. And here's another thing. I had to go through 4 or 5 different layers of management before I got somebody that could. Ridiculous. Imagine, Shane, if your business ran that way.
No, it wouldn't be a business.
No, but that's how government works. I mean, there are so many chief officers in a hospital now. I can't name them all. I mean, it's in a community of 23,000 people.
I know, making 6 figures. Which is, it's just ridiculous. I'm not saying there's not qualified people there, by the way. What I'm saying is, if you look at it in general, there is more heavy staff administratively than in other areas of the economy that is not in healthcare or government provided. Okay, big time.
Free Market Medical Association posted a thing about that administration has increased 700% since the 1970s in hospitals.
And what's that correlate? What's that year correlate with?
Well, Medicare passed in 1964.
Okay,
So,
well, I can tell you what year that correlates that with. That's when the U.S. government, I believe, you probably know this, started allowing businesses to make healthcare providing insurance a write-off and an expense. I'm pretty
yeah,
sure that's in the 70s.
I'm not sure about that,
Yeah.
but
And so again, it's going to cause the price to go up because people now think it's required. Anything
yeah,
that's required, yeah, somebody's going to, stab a knife in you and stick it around because they're going to jack up the price. And because you know what? You have no option. You
yeah,
have no option.
right.
But you know what that also does to you people? And again, I'm blaming the system. I'm not blaming you. I think everybody is going to do the best that they can for themselves. For you people that think it's good to have great benefits and great bennies at a company, it all comes from the same pot. And you might be good benefits, but they're holding your wages down.
Well, that's one of the fixes in my book. There's a 6-step solution in my book how to fix this healthcare pricing issue. One of them is that people go to their employers and they say, that healthcare insurance that you're paying for me, $1,500 a month for my family, I want the cash myself.
Right. Actually, I'll make a deal. I just want 1,000 of it.
Right. My wife and I, over the last 2 years, have saved $24,000 on insurance premiums. Yes, $24,000. Imagine what that can buy.
I'm in the same boat.
Insurance is a ripoff.
Yeah.
Remember, and this is in my book too, the best health insurance we have is not something we can buy. It's how we take care of ourselves. That's the best health insurance we have.
So tell me about this bill. So you get this bill, you start itemizing it. Tell me about some of the ridiculous charges that you see on it.
Okay. So, of course, here's one of the things that, and I got to say, they've been very nice in the process, but you can just see, you can tell they've met their match. Here's one of the things. I mean, here's just, they're not used to somebody questioning things.
When you have no facts involved, it's very easy to meet your match. When you can't explain certain charges.
Right.
Yeah. Okay. Go on.
So, first of all, you call the number to get through to somebody and they have it. Well, if you're on Medicare and your name is A through N, press such and such. If you're on personal insurance and your name is A through N, press such and such. There was really no option for me.
Are you serious?
Yes. At the financial department at our hospital, there was no option if you were cash pay.
I didn't know that Medicare got a separate person from normal insurance. That is a racket.
Imagine how much cheaper healthcare would be if we didn't have all that layer.
That is actually discriminatory.
Oh, totally. Total discrimination. Total discrimination. Okay, so I got a hold of somebody and they got me detailed bills. And we're still working on it. I'm going to question everything. I'm going to go through it line item. And of course, I know people in the industry. I know people that have worked at hospitals. I've worked at a hospital. I know what those drug prices are. I know what they pay for them. So for instance, a hydrocodone/APAP, generic Vicodin, hydrocodone/acetaminophen, generic Vicodin. They charged my son, they gave him 2 of them. They charged him $38, $19 per tablet. They probably cost him 10 cents. Okay. Now,
Shawn,
I get it. I get it. This is going to be their argument. It takes time for the nurse to give it. Okay. All right. I get it. Okay.
She's already there.
Okay. Just listen. I get that. So are you in the retail business or are you in the service industry? Because I also got a bill for $24,000 for 2 hours of OR time. That's a service price. Okay. So
wow.
The nurse is being paid for through the OR $24,000, $12,000 per hour, and to give me my son a $19 Vicodin that costs 10 cents.
This costs me the thing.
What industry are you in? Retail? And I get it. I have no problems with markup. I've got no problems. I do it in my pharmacy. But this is something it's not manufactured. I get it. Maybe if it's manufactured, it can be 100% or 1,000% markup. This is not manufactured. They took this out of a unit dose, gave it to my son, who was conscious, healthy guy. Ridiculous. Now, here's one of the things for you guys. Remember, don't feel bad about negotiating this price. This is what insurance companies do all the time. They don't pay these bills. They audit these bills all the time. So another thing is get ER notes, get OR notes, get all the notes you can so you can get orders from the physician. There was something on there. They tested my son for mono.
What? Why?
I don't know.
You know why? Because they can.
They can. 200 and some, no, $60, $200, whatever it was.
Well, see, I remember I had an accident. I fell off a ladder and I got good care. Don't get me wrong. But I did the same thing my brother did. And this has been years ago and I'm fully healed and so on and so forth. But, and I started looking at the itemized bill and there was a charge for $900 for drug screening. And I'm like, what was that for? They said, well, it's for everybody. You fell off a ladder, so we were wondering if you were under the influence. Okay, this is a guy that hadn't had a drink or an illegal drug in his life, right? And I said, I actually didn't consent to that. I don't have to pay it. And I didn't. Yeah. That is an absolute, but that's why they tested him for mono, because it's another test. And it's like,
well, yeah. I mean, I'm going to get the chart. I'm going to get the chart notes. And if the physician had
did they test him for COVID, by the way?
No. Oh, dude, I would have put the gasket. There's no way I would let that happen. Although this is a story for another podcast, but because of the social distancing COVID thing, they wouldn't let my wife bring him into the clinic a few weeks, the next week, because of social distancing. They said, oh, we only have one person here. She says, excuse me, I'm his mother. I don't care if he's 18. And can you see that he's not ambulatory? Somebody. Oh gosh, it's unbelievable. So here's another thing is too, people, stand up for yourselves.
Yeah.
You need to stand up for yourselves. Have a voice. Okay. Don't just be a sheep. Okay. And so yeah, the mono test. I'm going to get the chart notes. I'm going to find out if the physician had a reason. I don't see why he would have a reason to test for mono. So Janet said she didn't consent to it. Jordan didn't consent to it. So I unless there's a good reason, I'm not going to pay for that. That's because, it would be, and mind you, it would be no different than, and I've had these things happen. You go into a mechanic or an attorney. I had an attorney bill me for something I didn't ask her to do. I called her up and I said, you know what? I did not ask you to do that. She goes, okay, I'll take the charge off. Of course. Of course. It's like any other commodity.
Here's the problem, and I really appreciate you standing up for the system. And Shawn, I'll be honest with you, is that the majority of people don't have the courage to do what you're doing. They feel that they're embarrassed or that they can't beat the system, whatever. I hope you give people the courage. Please go read my brother's book, Sickened, How the Government Ruined Healthcare and How to Fix It. Find it on Amazon. What I like about this is that you do have to have a voice. And here's the problem. Even right now, you're one voice out of a million or more. And the problem is, people, viewers, listeners, stand up for yourselves, because this will never stop unless we continue to stand up for ourselves. And read these bills, look at the itemization. If you didn't consent to something, don't pay for it. If you take your, I mean, you've heard these horror stories, right? And the company usually goes out of the mechanic goes out of business, but you take your car in for an oil change and they change the tires. Well, you didn't ask for new tires. You don't pay for them.
But that happens in healthcare routinely.
Happens in healthcare all the time. Say, well, it's not the same as a car. Yes, it is.
Yes, it is.
Yes, it is.
We should be good consumers with our healthcare dollars, just like we should with all our dollars.
And by the way, the cost of cars and the cost of fixing cars has probably, because of efficiency and productivity, gotten better in the last 40 years, not worse. And so you can't compare them. And the same thing should happen with healthcare. Now, here's what people say. Well, it's all about electronic records. Did that cause the prices to go down? No.
Well, you realize that was mandated by the government.
Well, see, here's the thing. If the government is in the price game, which they are in healthcare, Shawn, how much is government, if we don't consider normal insurance and, private insurance, which the government mandates, by the way, through Obamacare and other ways, and mandates the prices, how much is Medicare and Medicaid pay for? Basically welfare. How much?
Well, and then you got the VA and stuff like that too. So state and federal programs, over 70% of all healthcare dollars are paid by state and federal programs. 70%. And realize you got state employees too. State employees, federal employees. Those are state and federal. That's state and federal dollars. Now, here's and I talk about this in my book. There is no such thing. If you have traditional healthcare insurance, I don't care if it's your employer. I don't care if it's Premier Blue Cross. Traditional healthcare insurance is government insurance.
It is.
Period. Why do I say that? It is so heavily regulated by the government. They are told what to pay for and the price to pay for it. So if you have traditional healthcare insurance, it's government insurance. And
Did you know?
I never want to go that route.
If you really want to get fired up, and you know what, come on my show anytime. I will be absolutely reasonable if you're reasonable and respectful to me.
Call in,
or call in. That is absolutely fine. Did you know now, because of Obamacare, I basically am paying for maternity coverage. I don't want maternity coverage. I can't even choose to opt out of it. Did you know, because of Obamacare, let's just say that you're a mom that has 2 kids and they're raised and you don't want any more kids, you're paying for maternity coverage too because of Obamacare. That's not right.
That's why we got rid of health insurance.
And you have now these young 18-year-old healthy males and females that don't want those things either, yet there's cost shifting because they're paying for the other portion of the market that isn't healthy. It is a complete racket. And it's like, I don't get why people still follow the system. And I'm just so appreciative of you standing up for it and being courageous, Shawn. So tell us more about this bill. Tell us more. You got $19 for a pain pill, which you say. So is that generic now? Hydrocodone?
Oh, yeah, it's generic.
You're saying cost of goods there is 10 cents.
Probably.
So that markup, oh my gosh, thousands. Yeah. Okay.
And here's another thing. And I'm going to go into this, and I'm going to, follow my Sickened page on Facebook, because I'm going to go into all the pricings of the drugs. Obviously, I'm a pharmacist, so that's a hot button for me, and I know how to get to it. So hospitals get special pricing, way less expensive than I do. It's called government pricing. Here's a good example. Oh yeah, here's a good example.
So wait. They get better pricing, yet
it's called 340B government pricing, yet they don't pass it on to the consumer.
I was going to say, yet they extort the consumer.
Let me give you an example.
Unbelievable.
Let me give you an example. You know what,
let me ask you this. That's only in hospitals?
No. Any kind of government clinic that has 340B pricing through a pharmacy.
Okay. So for example,
any kind of federal pricing.
Yeah. So any kind of hospital, 340B, but if you're a surgery center, you don't get those kind of benefits.
I think you could probably apply for it, but
right, of course.
It comes with a lot of strings attached, as you can imagine.
Do you see the importance, consumers, listeners, and viewers? Do you see the importance of shopping around? Your local hospital, I don't care if they say they're nonprofit or profit, it doesn't matter to me. It's all a smoke and mirrors game. I'm just telling you. That's a whole nother conversation. I don't think nonprofits should exist, period. Yes, I'm a conservative guy. That includes with churches. I don't think they should exist because there's ways around everything and there's games being played, especially in hospitals. There shouldn't be games being played because all that happens is when you make a profit at the end of the year, you just give a whole bunch of bonuses to all your administrative staff, your high level officers. And it's not right. It's not, or they give bonuses. That's not right. So I did not know that they actually.
Let me give you an example. I'm working with a guy right now that used to just recently stopped working at a hospital, and he owns his own compounding pharmacy. And Lantus, you know what Lantus is, right? Yeah.
Lantus is a diabetic drug, long lasting. Let's just put it that way.
It's a long acting designer insulin.
Yeah.
And as you guys have, anybody that's followed the news about healthcare pricing and drug pricing, it's been in the news lately. Those insulins have been in the news lately because they're really, really expensive.
I wonder why. I won't get into that.
Right. Listen.
Yeah.
So because they're really, really expensive, and of course the government, I think the government just passed a bill, and people are all kudos for the government passing this bill.
It's a joke.
No, it's a joke. It'll make it more expensive. So 340B pricing for Lantus insulin, $2 a vial. I couldn't believe it when he told me.
And the consumer pays. I don't buy the Lantus.
I don't know. Well over 500. Well over 500.
Over 500 now. It used to be 250. By the way, 5 years ago it was 250, and now it's 500. It's a racket. Now here's what I'll tell you. Here's like $2. A hospital gets it for $2, and then they're probably charging 500 at least.
Well, exactly.
Wow, that is a racket. And you know that goes in some legislators' pocket is what's happening. It's just greasy.
Well, and I will say that the chief administrative officer, whatever that is.
Yeah, what is that?
Called me from Samaritan, and he says, "You're a pharmacist, right?" He goes, "You know about how expensive drugs are." And I said, "Sir. I said, He goes, the drug manufacturers are really make expensive drugs. I said, sir, we're not talking about drug manufacturers. We're talking about retail dispensing of drugs. It's not manufacturing. It's totally different. Your markup shouldn't be 1,000%.
No, it should. Well, here's the deal. So let's just talk about these insulin designer drugs, okay? And I'm not saying they're not good, by the way. The technology is amazing. I'm a PhD chemist. The technology in the pharmaceutical industry, technology is amazing, okay? Has it saved lives? I would debate, okay? I'm not saying they're not good, but I'm saying there's been a drug around since the 1930s. It's called NPH that does not require a doctor's prescription. That, for example, my son, who's a type 1 diabetic, goes to. He's an adult now. And Shawn was just talking about $500 a vial, which is 1,000 units probably. You can get without a prescription, NPH for $25
right
at Walmart. Walmart. And I mean, people.
If you guys should watch episode number 1 of Health Solutions with Shawn and Janet Needham.
Because that was when I was on.
Yeah,
that's right.
And you can hear all about that.
Yeah, we talked about that. And so this is crazy. I'm glad that you've exposed this, Shawn. Keep exposing it. We're running a little bit out of time. What would you like to say for your final comments and your final, what would you like to say to empower people and educate them to say, this is not acceptable and it has to stop?
Right. So go through an itemized bill, get pricing on it, ask questions, compare pricing. There are websites out there. So find out what a broken tibia should be. Here's the thing that gets a little more complicated, but it's not that complicated. And if you follow my podcast tomorrow, I'm going to be interviewing an attorney tomorrow at 8:00 in the morning. He is actually involved in a possible class action lawsuit with hospitals and surprise billing and balance billing. And he says it only happens in ERs. So you watch for certain codes and they're in ERs. Now realize, so he gave me a code like Jordan's code. The average, because he's got this Excel spreadsheet. Technology is awesome. So you type in what this code is. So here's another thing. For your hospital bill, get CPT codes. Have them give CPT codes. Because then that's how they bill insurance companies. Now realize most insurance companies don't pay for all those CPT codes, but at least you can get kind of an idea. And you put in the CPT code and it'll say in your region, it'll say, okay, the average billable price is no lie. Here's an example. The average billable price for this CPT code in your region is $1,400. The average reimbursed price, take a guess.
1,000.
$245.
So why even bill it $1,400?
It's a racket.
It is a racket.
It's a racket. It's a complete racket. And they do it to capture all the charges because it's a racket. So stay tuned to my podcast tomorrow. Tune into my podcast tomorrow because it's going to be good. I'm going to learn a lot. And then
Shawn, we're getting comments that are coming in, by the way. And thank you, Facebook followers, for commenting that they would like us to follow up on another show and talk about this again. So I'm going to be on Shawn's show in August. I think we're going to be talking about a different topic, but Shawn, this is important. This is,
it is.
Think about the average person that, I won't talk about numbers. We all know what average people make and so on and so forth. If they have a $40,000 bill, or they're paying $1,800 a month in insurance, or their employer's paying for it, therefore they're not making $1,500 extra a month. I mean, that's the difference. You're making if your employer is paying $1,500 a month for you and your family. I know that sounds like a great benefit. Okay, that sounds like a good thing, but that's $20,000 a year in income that you could have instead. Wouldn't you rather have that, and then you can do what you want with it?
Read my book. Sickened. How the government ruined healthcare.
Facebook's blowing up. Thank you, viewers.
So one more thing.
Yeah. And I want to talk about one thing too before we get off the line.
So here's the thing about hospital discounts.
You're saying review the bill, itemize it, get the CPT code.
CPT codes, get ER notes, get OR notes. Follow my Sickened page, Sickened How the Government Ruined Healthcare page. If you go to my personal Facebook page, you can find it on there. And you can follow this process. So here's the other thing, hospital discounts, okay? And don't look at them as charity. Let me just explain this, okay? So I got a good example. I don't know where they're going with Jordan's discount. Here's what I'm expecting to pay. I'm expecting to pay about $10,000 bottom line. That's probably reasonable.
Now, viewers, let's back up there a little bit. And some people would say, wow, $10,000. That's a lot of money. It is. I'm not saying it's not. Shawn, how much have you saved in premiums in the last 2 years?
24,000.
Okay. That's why, for example, minimum insurance is the way to go. I mean,
And in my opinion, yes.
That's my opinion. It's just, I would rather have the money in my pocket. Does it mean you have to save it?
Yes.
Yeah.
And by the way,
you save for a rainy day.
Yeah. And by the way, with Christian Healthcare Ministries, I have the bronze program. So I will get reimbursed all but $5,000 of my bill. Right. Now, here's the first thing the hospital said. They said, well, why don't you just let us bill Christian Healthcare and they just reimburse you? Why does it matter? I said, seriously? I know. That's the problem. I said, people aren't responsible for their own bills. I'm responsible for this. They don't want that bill because they know it's their match.
They don't want the consumer responsible, the one paying the bill as the patient. They don't, because they can't juke them. They can't juke them.
Right. So let me give you an example of these hospital discounts. These happen all the time. And if you follow Christian Healthcare Ministry, Shane, you see this all the time in their monthly magazine. How, there was a hospital bill of $100,000 and the hospital wrote off, $70,000. The bill was $30,000. That's all the time. Now remember, this is not charity, people. This is billing what they should have billed in the first place. It's not welfare. It's not. This is not state insurance. This is not state Medicaid. This is the hospital charging what they should have charged. I got a great example. My brother-in-law, he was uninsured. He had thyroid cancer. He goes in, the bill's $70,000. He signs up for all these. He didn't want to go under state welfare insurance. So he signed up for the hospital discount programs. And they had a discount program through their foundation, left pocket versus right pocket, right?
Robbing from Peter to pay Paul.
Right. So the bill essentially went from $70,000 to $12,000. The interesting thing was that surgery at the Surgery Center of Oklahoma to start with was about $10,000. Yeah, that's what it should have been. They're charging the real price. So don't think that the hospitals are getting screwed. They're not. They're not at all. And insurance companies probably pay 30 cents on the dollar at best most of the time, if you include Medicaid and Medicare. So
I think what we're finding, and most people in healthcare, I have a lot of close friends in healthcare, and what we're seeing actually in hospitals due to COVID and whatnot is you're seeing that hospitals were probably overstaffed. They were absolutely overstaffed.
Most of the government entities. And
they had too many buildings, too much capital equipment, too much staff. And now it's going to have to, contract and kind of reinvigorate itself and see what happens on the other side after COVID, because it's being affected, obviously.
Well, and here's the thing I will say too, whether you're a public hospital, clinic, or whatever, if you're billing Medicare and Medicaid, in my opinion, and that's most of your business, you're a government clinic, period.
Totally are.
If your major payment sources are from the state and federal government, you're a government clinic.
You are. Yeah. So one thing I want to add to, so Shawn talked about reviewing that bill, get an itemized bill, get the CPT codes. And you know what? He's saying, don't be a sheep. Have a voice, stand up for yourself. Do not be afraid of this administrator that is whatever they call him, chief finance administrator. They put their pants on one leg at a time, just like you do. And you're the player. You're the one in control of the situation.
You're the customer.
You're the customer. So
and it's no different than anything else. Think about if you were getting your car fixed in a mechanic, you were getting your house remodeled or your air conditioner fixed, you would ask the same questions.
Absolutely.
How much did it cost? And that didn't, oh, wait a minute. You fixed it, but it's still not fixed.
You're right.
I'm not going to pay you.
Right. I just want to add before you get there. Now you might have an emergency situation like a compound fracture, like my nephew did. Okay. I get that. Get your son there, get your daughter there, get yourself there, whatever, get stabilized, do whatever you have to do to make sure you're healthy. Right. And then once you start coming to, or the person that's with you has their wherewithals, start asking questions. How do I get a discount before I check out? And maybe you can't afford the whole bill. Be
careful about that, because if you listen to our radio show a couple of weeks ago, we had a guy that was in Arizona that broke his leg, and he asked for a discount before he checked out, so he paid the whole bill. The problem with doing that, if it's a big bill like that, there's all these surprises and stuff, and you're probably going to overpay. So on a bill like that, like if it was a bill where they're a clinic that really knows the price, and they know what it's going to be, and they know right away it's going to be $700 you pay us right now, I would be for it. But if they say, well, we'll give you a 10% discount off of $40,000, you're going to give me a 10% discount with something that should have costed 10.
Yeah.
No, I'm not paying today.
Right. That's a good point. By the way, I've had simple procedures that are outpatient surgery that you go in there. It's $1,100, for example, to if you pay with insurance, $500 cash. And I gave him 5 Benjamins, and I was out of there in a half an hour. It was that easy. It was that easy. Now think about that. Think about this. I know that might sound like that's weird to pay cash, okay? But I've done it. And, that just seems strange. Well, your cell phone bill is probably about $100 a month for one phone.
Yeah.
One phone. So when people say, well, that's a lot of money or whatever, it is a lot of money. But it's like you have to put your priorities straight. And so, Shawn, this has been a great show. This has been really fantastic. I love your charisma. I love your enthusiasm. I love when we can talk up this way. And by the way, I had very few notes on this. We just let it roll, and that's the best thing. And we're having lots of viewers. I'm watching them come in. I'm watching them give the likes. I'm watching them say they want to see us again for the same topic. So really, really good job, and happy to have you. It's just an honor. Go to my website, drsneedham.com, where you can see more about all the information, all my previous podcasts, more information about me. Follow where this is being recorded, and we'll have it on YouTube, on iTunes, on SoundCloud, and on Spotify in the next week or so. And by the way, my computer-generated expert, the guy that puts all my stuff and records it and edits it and puts it online, is the guy we're talking about. His name's Shawn Needham, and he's my nephew, and he's the one that broke his leg. And you know what? He's still been working with me and hasn't missed a beat.
How many shows has he missed because of a broken leg?
0.
I know.
And he didn't even tell me about it. Never said, he never even made an excuse like, hey, I'm going to be late because I got a broken leg. Never did nothing. No excuse.
You know why?
Yeah, I'll tell you why. Because Shawn, you have shown him a work ethic of no excuses and never be outworked. That's his mom. And his mom has too. His mom raised those kids, would bring them into the pharmacy because you guys couldn't afford to have pharmacists. You guys would have to do it yourself and run it yourself. She gets up early, going to bed late. I've seen it happen.
We homeschooled our kids.
You homeschooled your kids. She homeschooled the kids and was still a pharmacist, and Shawn was still running the business as well.
And
incredible.
In the 20, she's the hardest worker I know. I mean, definitely. And in the 22 years we've been in business, neither one of us has ever not been able to make it to work because we were sick or for any reason. Never.
And those are different stories. I've heard about how sick they were once and had to go to work. They're crazy, crazy stories. And so you've shown it. This is, as you know, it's a Secrets of Success podcast where the theme is never be outworked, Shawn. You and Janet and your son, Jordan, you guys all have that mindset of never being outworked. And it's not going to be about your background and your experience and how much education you have in this life. It's going to be that you have that mindset of never be outworked. You guys are great examples of that. I really thank you for being on the show. Can't wait I'm going to download this right now and send it to Jordan. And in a couple of days, I'll hear from him.
Right, yeah. Tune into my podcast tomorrow morning, Health Solutions with Shawn and Janet Needham at 8:00 on my Facebook page, streaming live.
Excellent. Go find Shawn, my brother, Shawn Needham, on Facebook. You can find him there. And thanks again, Shawn, and say hi to the family, and we'll see you soon.
Thank you.
Thank you. Bye.